Hi everyone, you're listening to the Health and Wellbeing podcast. I'm Alison Mitchell, a practicing naturopath, and you can find me on naturopathinsw.com.au. These podcasts will feature discussions on various health conditions, health tips, and nutrition from a naturopathic perspective. Sometimes it's just me, sometimes I'm interviewing guests. All the time, I hope to share with you information on health and wellbeing with the aim to empower and educate. Please remember that all information is general and not a specific recommendation that replaces consulting with a practitioner. Please talk to your healthcare practitioner before undertaking any changes to your treatment regime. Hey everyone, welcome to this episode. Today I'm going to be talking with a physiotherapist who specialises in women's health, and we've got some great content to talk about. It's all about tightness of the muscles in the pelvic floor and how this can affect all sorts of other conditions. So it's actually a really fascinating topic because I think that this is something that a lot of people don't know can happen that much. And when people do experience tightness in this area, quite commonly it gets a bit dismissed or it doesn't get brought up by other health practitioners. So all the things that can occur in this area can actually have a widespread effect on the rest of the body, in particular the conditions of the pelvis. I first encountered the concept of hypertonicity when I was doing some of my further research into my conditions such as endometriosis, because I'm quite interested in women's health in my clinical work, and understanding the link between the tight muscles of the pelvic floor and how that can contribute towards various conditions such as PCOS or endometriosis or IBS is really, really fascinating. And one of the other areas that I feel like it's really important to address is something called vaginismus, which is essentially vulval or vagina pain or the pain during intercourse. And so this can be a real big issue for a lot of women, but it's not something that actually gets commonly addressed for them. So there is something that you can do about it, and that's where the women's health physio comes in. So I first started to see Brooke when I was pregnant with Lara, and I wanted to make sure that all my pelvic floor area and my pelvis alignment and everything was in tip-top shape, because I was really, really keen to have a natural birth after having to have an emergency Caesar for Ash. And Brooke was just a wealth of knowledge, and, got chatting with her about all these sorts of things because it's such an area that I'm interested in, and it's something that Brooke is also really passionate about as well. And Brooke's passion is to empower and educate other women, and so I said, come on the podcast, Brooke, and she said, sure. So we've got great content to share with you today, so I can't wait for you to hear it all. You will also get to hear baby Lara, who has been born, thankfully, with a vaginal birth after cesarean, or a VBAC, so that was successful. And I had written a blog post about that on my website, naturopathinsw.com.au, if you do want to hear about that and all the things that I did to try and help me achieve that. And so you'll get to hear Lara as well, and she's such a cute little bubby and she's going really, really well. I hope you enjoy this episode today. So today I'm joined with Brooke Hile, who's a women's health physio in northwestern Sydney, and she has a special interest in the pelvis and all dysfunctions that can surround this area. She's worked in the maternity unit at Fairfield Hospital as well as in private practice, and has been guided by some of the best women's health physios in Sydney, including Taryn Hallam and Jolene Murdoch. Brooke aims to empower women to feel confident in their bodies, to talk about the issues affecting them, and encourage all women to seek help when needed to allow them to reach their goals. So hi, Brooke.
Hello, thank you for having me.
Thanks so much for joining us. I'm really excited about being able to share this information. So let's start. What is a women's physio, and how is that different to a physio that most people would be familiar with?
So as a women's health physio, we do cover all of the areas that other musculoskeletal and sports physios would cover. So we deal with issues of the hip, the pelvis, the back, those sorts of things. But we also deal with conditions specifically relating to women. So we might see them for pregnancy-related pain like pelvic girdle pain, low back pain. We also see them for pelvic floor issues, so incontinence, prolapse, and pelvic pain like hypertonic pelvic floor.
Awesome. And so that's what we're going to be really getting into today is hypertonic pelvic floor, because I think that's something that a lot of people don't really know of.
No, it's
people think about pelvic weakness.
Very, very uncommon. And what a lot of people don't realise is you can have symptoms of incontinence but still have a hypertonic pelvic floor, which most people don't realise. They always think, I've got a weak pelvic floor and that's why I'm incontinent. So
yeah, so they go
big topic.
Kegel, Kegel, Kegel.
Yes,
but that doesn't
and
really
make it worse.
Yeah. Okay, so what are the symptoms that women would get with hypertonicity?
So there can be a lot of things that they can be experiencing. I generally, in my subjective questioning, want to know a lot about a history of painful periods. They may have had a history of falls onto their tailbone, which can cause their pelvic floor to really contract and tighten up. They might have pain with intercourse, with use of tampons. They might
bless you, Lara.
They might also have issues with their bowel motions. So a lot of women with hypertonic pelvic floor can have irritable bowel syndrome or gastrointestinal issues, which causes their pelvic floor to really tighten up. So they might have chronic constipation or diarrhea symptoms, which can be contributing as well. It's not always pain that they're coming in for. So a couple of different things.
Yeah, so that's really interesting, because the lack of awareness of it would mean that the people could have these conditions and not get the right treatment for it for a long time, because no one would be referring them appropriately because there's just not that knowledge.
Yeah, I was reading on Jean Hile's Institute the other day, actually. It generally takes about 7 years for women to get diagnosed with pelvic-related conditions like polycystic ovaries and endometriosis. So,
yeah.
And then even longer, up to 10 years for them to get appropriate treatment for it. So
it just seems to be such a lack of balance between male and female health, doesn't it?
Very much so.
Yeah, that's a topic for a whole nother day. But yeah, so this is one of the reasons that we're doing this, is to spread awareness. And so if people think that they do have an issue in that area, would the biggest clue be that they're unresponsive to other treatments?
It definitely can be, particularly if they're having musculoskeletal injuries associated. I've had a big area of that at work at the moment. One lady in particular that I was seeing had just hip pain on one side ever since she was pregnant, and she'd had a fall. She was seeing another physio for 12 weeks, no change.
Yeah.
So when we spoke to her about it, she'd had issues with pain with sex, she'd had pain with tampons, never able to use them. When she did have her babies, she tore significantly, but that was never followed up on. So when we did an internal exam, we found that she was really, really hypertonic through that left side pelvic floor, the same side as her hip pain. We released that and her hip pain settled significantly. So a lot of the time, yeah, they don't respond to the traditional treatment modes. And I haven't had much experience with it in other areas, but particularly in musculoskeletal injuries, definitely.
Okay, yeah. So what then? So everyone can hear my little baby Lara having a little squeak in the background. So what does the treatment usually involve when someone comes in for that?
Yeah, a lot of different things. So we take a really thorough history. Generally the first session we'll just be talking. Yep. We want to understand why it's hypertonic. So we want to understand where it's coming from. It could be that they're not breathing appropriately, and so they're really tight in their mid-back, and that's putting more pressure through their pelvic floor, causing it to tighten up. So that initial, history taking is really important. And from there, we can sort of work out where we direct our treatment towards. So if they were a poor breather, then we teach them to breathe. If they do have issues higher up the chain with their thorax or lower down with their hips, we want to treat that first, rather than just jumping straight into the pelvic floor, which is very uncomfortable. So I try as much as I can to treat externally first, because a lot of the time if you don't do that and you just target pelvic floor, you won't get the best result possible.
Yep.
If there isn't anything else external, then yeah, obviously we'll start to look more internally at the pelvic floor, and we might start looking at doing some releases through the area, some teaching of relaxation and cueing with breathing. A lot of the time I'll use a real-time ultrasound, or I have a machine called a peritron, which measures pelvic floor squeeze and resting pressure. But you can also see the relaxation that happens when women can let go of their pelvic floor. So training them into what it feels like to relax is really important. But also we can use things like a Swiss ball to feel that relaxation happening.
Yeah. I know when because I've had treatment with Brooke as well, and I found it really interesting using the ultrasound to actually see the muscles relax, because you just don't know what's going on in that area, really. You don't have that same sort of awareness of those muscles, and so to actually see it take place on the ultrasound, so when you contract and then when you relax, and for me it was like, and it's just not relaxing.
Exactly.
Yeah.
But even with the peritron, sort of seeing that there's all these numbers and then just watching the numbers go down and then feeling what does that feel like to let it go. And same as the ultrasound machine, seeing that drop that happens is really helpful, because otherwise, you don't know what it feels like.
It's like biofeedback.
Yeah, very helpful.
Yeah, so you're able to sort of get that lesson for yourself there, and then you can repeat it again afterwards.
Yeah.
So just to go backwards a little bit, can you actually define what hypertonicity is?
Yes. So as the name would suggest, it means that there is increased tone in a muscle. So it could be for two different reasons. It could be because it's really overactive and that's why it's tightened up the muscles of the pelvic floor, or it could be that they're extremely weak and that's why they've tightened up. So it could be for a couple of different reasons, like some of the reasons that we spoke about earlier, whether they've had a fall and so they've just tightened up in response to that and gotten overactive and tight, or it could be a lot of significant weakness that they've just switched on to try and protect, basically.
Okay, like to compensate for that.
Yeah.
Okay. So now we were talking a little bit about the treatment before. I think the $1 million question is, what does the internal treatment involve?
Yes. So the $1 million question, internal treatment, we treat the inside of the pelvis very similar to externally with muscles. So if you go to see a physio for back pain, they might massage those tight muscles out and then teach you how to turn other muscles on. So in terms of pelvic floor treatment, we do some internal massage.
Yeah.
Sometimes it involves finding trigger points and holding those positions while the woman breathes. Sometimes it's full releases.
Yeah.
So not very pleasant. Yeah.
Yeah, it can be quite painful when there's a trigger point anywhere, but particularly in an area where there's a lot of extra nerve endings.
Yes, it's very sensitive.
Yeah.
I often liken it, if you've ever had dry needling by a physio and that deep achy feeling that you get in that muscle, it's very similar to an internal release.
Yeah. And similar to other massage, it can hurt a little bit afterwards, can't it?
It can be a bit uncomfortable.
Yeah.
Usually in the first few sessions we go a little bit more gentle, just so that we can see how the body responds, especially in women who might have a really strong emotional component there. It can result in a lot of issues later. Yeah. So it's another reason why I try and treat externally as much as possible first. But yeah, it's one of those areas you've got to be pretty careful with.
Oh, yeah, I would imagine so, because everyone's so different in that area too. And then with something like hypertonicity and vaginismus, then that's going to be something that it's going to be really, really hard to start with, isn't it? Yeah.
And it can be very scary for a lot of women as well. Particularly, there's some women who have it who may have a history of abuse, and so that's a very sensitive area for them. So any form of internal work is always going to be quite difficult.
Yeah. But luckily, you are so lovely that a lot of women will feel more comfortable about it after.
Yeah, a lot of it comes down to how you approach the whole session and the explanation that you give the woman. So,
just while we're on that topic about vaginismus, which is pain during intercourse, that's something that a lot of women get dismissed about when they see their doctors, or not even really get told that there's an actual problem in that area. Can you talk a little bit about that?
Yeah, definitely. A lot of women that I've seen, as you said, they do get dismissed. It sort of tends to be a bit of a, oh, we'll go and have a glass of wine and relax and just do it, which is horrendous. Very horrendous. And that's why a lot of women just put up with it for such a long period of time.
Yeah.
And from my experience, a lot of women don't tend to talk to their partners about it because they think it's a problem with them and it's not something that needs to be treated together. So it's a difficult area, working out why it's there and why those muscles are turning on, just like normal hypertonic pelvic floor. But you've got to work with the partner as well and have that really open communication to make sure they know what's going on and they can appreciate what the woman is going through so that they can work together on finding what option works best for them. I have spoken to a sex therapist in the past about it, and she works a lot with partners with vulvodynia and lots of pelvic floor issues. And her big thing is that open communication and teaching the male what the female is going through and learning that the experience of sex, is not about the end result of orgasm, it's about the process. And so once the partners can work that out together, then it tends to be a lot smoother process.
Yeah, for sure. Right, so is hypertonicity associated with other sorts of conditions quite commonly? Like, is there a link between conditions such as endometriosis and hypertonicity where they feed into each other, or similar to that?
Yeah, definitely. So a lot of women with endometriosis and particularly polycystic ovary syndrome tend to present with a hypertonic pelvic floor as well. A lot of the time they can have other symptoms of painful periods, so I think that feeds into them really gripping on with their pelvic floor due to that pain. And so I think that's why there's such a link between the two of them. There's also issues with women with irritable bowel syndrome because they're generally, if they have more of a constipation type issue, they're always pushing and straining, so their pelvic floor muscles start to really contract and work really, really hard and tighten up through that process.
Yeah. And I find it interesting as well how there's a real strong connection between the inflammatory component of some of these conditions and the hypertonicity as well, because when you've got that tight muscle creating pain and you're getting the inflammatory response, and that feeds into all those inflammatory chemicals into the rest of the area, and as we know, endometriosis particularly is a really inflammatory condition, so then that makes the whole condition worse. So for complex conditions such as that, like, I find it really valuable for women to see a women's physio, because you've got to treat all the parts of the jigsaw puzzle. Like, it's not just one component. You can't just take hormone control or anti-inflammatories. You've got to also deal with all those other factors.
Yeah, exactly. It's like with other areas, you don't just want to treat one symptom, you want to treat the whole person and try and work out exactly what's causing the dysfunction in the first place. So working together is definitely a big thing.
Yeah. So hopefully, like, if you've got something like that, then you've got to be building a team around you that can deal with all of those issues.
Definitely.
Yeah. So are there any exercises at home that women can do to help with hypertonicity?
Yes, it is a tough one, especially if they haven't been assessed in the first place. So I would always urge women get assessed first,
right? Because
like we were talking about, you don't know why they're hypertonic in the first place. So they might try and do all of these exercises, but they might not have a hypertonic pelvic floor, so it's not really going to be helping them.
Yeah, like you said, it might be the ribs or
it could be coming from somewhere else. But some of the exercises that I often like to do with women, hello Miss Lara. Some of the exercises that I often will give to women or like women to be doing involves the Swiss ball. So just feeling for that relax and let go, which even women who need to work on turning on their pelvic floor need to work on letting go as well. It's just as important as the squeeze. So I like getting them seated on the Swiss ball so that you can feel the whole perineal area, the area of the pelvic floor and vagina, and just feel the pressure of the pelvic floor, not necessarily pushing or bearing down, but just noticing it there.
Yep.
And then feeling it as you breathe, just let go and relax. A lot of imagery can be really helpful for that. So when I'm describing pelvic floor, I often think of, if you think of a creek with a pebble, if you drop the pebble down, there's a drop, and then there's all these ripples that come out of it. So that's sort of what a pelvic floor relaxation should feel like, because when you turn on your pelvic floor, there's a squeeze and a lift, so the let go and relax should be the opposite kind of effect. So thinking of that can really help, or thinking of flowers opening up That can be what you can imagine happening around the vagina itself. And just breathing exercises. Child's pose is a nice way to feel the pelvic floor relax and just breathe gently into it.
Nice. I remember doing the opening rows in my hypnobirthing class.
Yes.
And then the other one that I learnt was going down the elevator. That was a good one for imagery for that. So like you raise the elevator, like you go up to contract, and then you go down the floors and you lower each floor progressively.
Oh, that's clever. I like that. I might start using that one.
So that's awesome. That's all awesome information and content. Do you think that women really need to be talking about this more? Because like we've said before, there's definitely a lack of awareness.
There definitely is. I was reading the other day that only 25% of women with pelvic pain or sexual dysfunctions actually seek help for their conditions. So I don't know whether it could be the fact that nobody talks about it, or the women who have reached out for help haven't been treated effectively or well enough that makes them feel comfortable to continue on their treatment path. But it is a really, really big area that needs more communication about it, more discussion, and I think the more people talk about it, the more open and safe women will feel discussing it. That's why it's really nice to be talking about it now, and hopefully urging women to discuss it. Women's Health Week's coming up in 2 weeks, I think, so it's a nice time to talk about it as well.
Well, probably by the time this podcast comes out, it'll be around that time.
Beautiful.
So there you go.
Nice.
I think that one of the reasons why a lot of women don't get treatment is because like they're a little bit scared of the treatment itself. So knowing what entails and what happens, and hopefully we've shed light on that with this podcast as well, that it's like it is a little bit awkward, but it's okay once it's done, and then you get it out of the way. It's like ripping off a Band-Aid, isn't it? Like you get it done, you get it sorted, and then once it's done, you can enjoy lack of pain and hopefully better sexual relationships as well.
Exactly.
Because with the vaginismus that we were talking about before, that takes such a huge toll on people's relationships. Definitely. And if it just gets dismissed or ignored, then that can really deteriorate.
Yeah, I think it's sort of when you weigh up the options of having constant pelvic pain or not being able to have pleasant intercourse versus a few sessions working on release work despite being uncomfortable for a better outcome, I think it's best you get the treatment and then you work on everything to make sure everything else is covered and sorted, and as you were talking about, good relationships and better mental and emotional health down the track.
Yeah, definitely. Okay. Is there anything else you want to add?
No, I think that's covered most of it off.
Awesome. So thank you again for joining me. So if people want to get in contact, how can they do that with you?
So at the moment I do have an Instagram page called Things Down There. So I'm happy for anyone to send me messages on there and get in touch that way. It's also got my booking page for work, so have a chat with me first and we can work out whether you need to come in for an assessment or not, or if there's someone closer to you, then I'm more than happy to refer women there as well.
Yeah. So because you're based in the northwestern Sydney area, but for people who are elsewhere, how can they find a women's physio?
On the Jean Hale's Institute page, there are a series of posts about where women's health physios are located.
Jean Hale's, okay.
Jean Hale's, yep. Otherwise, most GPs should be aware, hopefully. Not always the case, but Jean Hale's is a great place to start, definitely.
Okay, great. All right, well, thanks again. And do you think you'd like to come back on and talk about some other topics at a later date?
I would love to. It's been fun.
Yay! Thank you. Bye.
Bye.